Hey, this is Dr. Len Schwartz with your practice building tip of the week, and this week I want to talk about new patient objections when presented with a treatment plan or a corrective care plan in your office. There are 4 common objections. The first being the most common, which is money. So if you have new patients that are objecting to starting care in your office because of money, congratulations, you're normal. But what does that tell you? In many instances, what that tells you is that you have not done an adequate job in communicating the value of your care on the first or second visit, or however many visits it takes before you present the financial or corrective care plan. So you may have to take a look at the way you're presenting your care, your treatment options, the value, what it will do for them in their life, whether they can work again, play with their kids, live without pain, have normal function, whatever it is. That's something you really need to pay attention to. And so when somebody objects to money, if you are completely inflexible, don't do payment plans, only accept cash, don't really offer the patient different ways to pay you, then you may be running into this problem more so than the other chiropractors watching. But if you offer payment plans, if you have a flexibility in your financial policies, you're probably going to be able to take that patient who initially objects to money or paying you a certain amount of money and convert that patient over to a patient that stays, pays and refers for the right reasons, which of course is all based on your corrective care plan. Number 2, if they tell you they don't have time, then they were never serious to begin with about wanting to correct the cause of their problem. And again, that takes place on all of the visits leading up to the presentation of a corrective care plan and or financial plan. Third, I've got to talk to my spouse. Again, if you're hearing this, you're normal. But I guess the only question you need to ask that patient who says that they have to talk to their spouse about it is this, and this is a $1 million question, and it goes like this. If this corrective care plan was free, would you still need to talk to your spouse about becoming a patient here in the office? And then let them answer. Because that whole "I have to talk to my spouse" response is probably just another way of telling you they initially object to the money. And so maybe it's their spouse who has to say yes, they can pay you to become your new patient. So ask that question. You will find the results to be absolutely amazing, because then you will get to the true objection. And then finally, and this is probably one of the most, if not equally as important as the money, and that is they don't necessarily see the value in your care. And again, I hate to tell you, but it all comes back to you and how you were able to effectively communicate the value of your care and what chiropractic can do for them in their life. Hope this helps. Have a great week. Talk to you next time.